Health IT giant Cerner has entered into a new era, shifting its technology offerings from traditional EMR into a major focus on patient wellness and greater care outcomes. We're pleased to have Joanne Burns, Chief Strategy Officer at Cerner, and she's speaking with us today on Red Hot Healthcare. Let's go!
3 alarm at 21 and north. All engines respond.
This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and welcome to the show. I'm your host, Steve Ambrose, and you can subscribe to Red Hot Healthcare on iTunes, Stitcher, and other podcast directories. And we love to hear from you. Just send your comments or questions to steve@redhothealthcare.com or hit me up on my Twitter handle, PolymathSteve. Today's show is being sponsored by Medisend, any size medical office, facility, or hospital. Let Medisend analyze your current medical waste services and fees. You can remain with your current waste vendor, and Medisend will lower their ongoing fees to you. Medisend gets paid only if you save. Or switch your medical waste services to Medisend. They often save new clients up to 30% or more off current vendors, and fees remain level from year to year. Just go to redhothealthcare.com, fill out a few fields. Guys, I can't do any better than this. Medisend is good people with great intentions. Save with Medisend today. And now, we're ready for the show. Joanne Burns is the Chief Strategy Officer for Cerner Corporation. She advances Cerner's strategic initiatives and direction with expertise in healthcare delivery, IT, cybersecurity, large-scale program development, and strategy. She's an executive powerhouse who carries major team leadership responsibility for a $4.5 billion company in 35 countries. Thanks for coming aboard Red Hot Healthcare, Joanne. Nice to have you.
Thanks, Steve. It's great to be here. I really appreciate the opportunity to speak with you and your listeners.
From the company's website, the mission of Cerner, as I've read it, is to contribute to the systemic improvement of healthcare delivery and the health of communities. So my first question to you would be, what is the direction as well as the core strategic initiatives of Cerner that support this vision statement?
So recognizing that the EMR is really the launching point for capturing healthcare delivery and of patients and care providers and how they interact, but also recognizing that we all get as consumers and people healthcare in a lot of different places, and it might be through our local gym, and that's really the emphasis on the care side of this statement versus the health. Or it might be at the grocery store or other places in the community. It might be through our church, our employer, or any place else that you can think of interacting, which may be gathering data and information on you that can contribute and give a full picture of how you are and how you're progressing on that health and care continuum. So what we're really doing is creating platforms to gather that information and data that creates that robust full picture of you as a person, or you as a patient, or it could even be you as a consumer, and how that's contributing overall. We're doing a lot around technology. Technology is obviously our core and what we know best, but the reality is we also provide services. We work with employers. We work with other care providers. We work also with retail pharmacies and different organizations that are really entering into thinking through what health and care is like for people sort of broadly.
You know, you touched on something about the different care centers and the different facilities now that carry patient records, and I've read about Cerner's efforts towards interoperability. I'd like to have you give our audience members a little bit of understanding as to where Cerner sits now on interoperability between different systems, as well as what you're doing to bring about a true fix towards patients having an ID that they can carry from facility to facility?
Yeah, that's a great question, because interoperability, not only is it a buzzword, it's absolutely critical to our future as people and kind of how we're getting that full picture of our care. So interoperability isn't just how you think about just transferring data from one record to another, or an interface, which is how you might think about it in the past. That core electronic medical record, or that chart, which is now in a computer. The reality is there's a lot of information there, but there's also a lot of functionality that some of the subspecialists or specialty care delivery may need, that not every EMR vendor is going to create, or not everybody is going to have. And there's a lot of very specific applications, if you will, apps that are out there. Interoperability at its most basic format in our mind is that EMR becomes a platform where you can plug in some of these apps that could actually fit within your workflow as a provider or a patient and add value. So it could give you specialty information that I might need, say, as a pediatrician or as a cardiologist, something like that, but leveraging standards. I think another part, and this goes to your part around the patient identifier, is that how do I know that Joanne Burns, which tends to be a more common name than any of us would have imagined, that the record is really mine that might be out there on another computer in another system? So really, when you talked about the patient identifier, I should have a specific unique identifier that's mine, that recognizes that that's my record over in that other system. So we've created Commonwealth, which is really a number of different EMR suppliers and others that came together and said, we really need to solve this for the good of everybody. So Commonwealth creates this platform where patients or people can select their own identifier. So it would be like your sign-in or your login to another system, where it ensures that your records are secure. It ensures that you're providing consent to share your records, and it creates a record locator service where it knows that a record is out there and available, that there's another record in another system for Joanne Burns.
One of the things about Cerner, too, that I know is you're out there in the field making it happen with constant innovation. I mean, even the next generation of medical record is being worked on by Cerner. I know that you've partnered with Intermountain Healthcare, a great organization, and they're highly innovative in their own right. Has this update to the next generation of medical record been released yet?
The good news about it for all of our legacy clients that have been with us for so long, and everybody yet to come and working with us now, what we're doing with them is creating enhancements within Cerner Millennium and the electronic medical record, which really is able to embed care pathways and different things that, the quality, the outcomes, things that Intermountain is known for. And we're able to embed them within the system and deliver them. So a lot of the work we've been doing with Intermountain has become a basis for our model experience system that we're deploying now. We've, in addition, taken updates and information from subsequent clients that have been able to participate and give us information. But then truly the other thing is the ability to build in the intelligence that helps with very active, if you will, decision trees or algorithms that drives you down different care pathways depending upon information that's already in the EMR or information that is yet to be put in the EMR in context of that decision system. So that's all work in progress and continuing to be deployed across Utah, as well as being embedded and thought through as part of our model system.
Joanne, one of the things I want to get into, and I've talked to this point with other guests too, and I really would like to get your feedback. I see a presumptive argument that's made by health systems, hospitals, healthcare IT companies, that just because now we have lots of new technology, big data, telehealth, mHealth, to capture and coordinate patient-generated healthcare data and coordinate care, that naturally patients are going to just come along, change their lifestyle, start providing their data willingly, and hop on board. I don't see that happening. I see that engagement is going to be a tougher nut to crack, largely because the motives for hospitals and health systems, and certainly to some extent IT companies, is there. You're going to have to do all of this in order to actually get paid under a new value-based care system. But patients, and especially healthcare consumers in a country that carries a lot of chronic disease, a lot of poor lifestyle choices, and massive care unaffordability and coverage unaffordability at this point to the average consumer, I would make the assumption, and probably, I don't think I'm going out on a limb here, that engagement is going to be tougher. Have you thought about this at Cerner? And if so, do you have any services or products or designs of products that are specialized towards better patient engagement?
So, gosh, great question. And so what I would say is that there's several factors going on, and then I'll talk about what we're specifically doing. So I think the forces, if you will, from whether it be the government, from the environment, from peer pressure, whatever it might be, patients, families, all of those are going to play a factor into it. You've also got a next generation of millennials coming up who are very used to having information at their fingertips. And they tend to be a little bit more engaged, not necessarily the people who are not engaging in their health in general won't necessarily seek the technology, but the technology being a barrier has to be out of the way. And you need providers to change their mindset around it and how they engage, whether it be physicians or hospitals, clinics, outpatient settings, et cetera. There's a whole lot of dynamics that have to change and continue to evolve to ensure we're getting engagement from our consumers or patients. I think one of the things that we're doing first and foremost is we started probably about 10, 12 years ago to start thinking through, hey, our cost of care as an employer and cost of healthcare was going up. And what we did was actually take within our own employee base, can we start to change some behaviors and work on a plan? So we developed our own health plan, really administer it ourselves. But core to that was, can we provide incentives and do things to engage our employee base differently so that we can start to improve care, improve outcomes, and really start bending that cost curve, but also improve productivity of our associates, improve their work-life balance, if you will, so that they're able to spend more time when they're not working. They're healthier, so they're able to spend more time engaging in the activities and with their family and friends that they want to do. Then we started to continue to evolve that, and we created centers of excellence around benefits plans. So, for example, for labor and delivery, created and really kind of drove care around that, staying well, engaging in a program, and then trying to drive to, here's the centers of excellence where we have the best outcomes. So what we use that then as almost a living lab for how we go work with health systems, how we design our software, and how we really create that patient engagement, consumer engagement, technology and application. So that's a big part of, and core to our culture, is leveraging where we can our own associates and base and teams, if you will, as learning labs to innovate and get ideas and understand what could work or not work.
That's great stuff. And a lot of people, I think, believe that engagement is just about getting the patient or the consumer to say, okay, I see your point, I'll do it. But I think if you really don't enter into a relationship, and especially a trusting relationship, where that patient or that healthcare consumer really not only believes what you say and understands it, but then they actually follow through repetitively because they value it.
Right. The EMR is one source of data. It's not all, and you've got to really be thinking about the community and social determinants. As we get smarter about that as an industry, as a population, as, even, kind of across our country, that information can actually come in and help us determine what's the right course of treatment for you. So taking in social determinants, what are factors that could incent, Joanne differently than Steve differently than anybody else that's out there? That all has to go into really understanding, how do I get a very personalized plan of care or plan of engagement that really has to drive. And that's where you start really thinking about the power of all of this information. The world is going to be changing dramatically.
Let's talk about telehealth.
Okay.
Recently, I saw that Cerner announced a telehealth agreement with American Well. Clue us in a bit on the underlying strategy that Cerner had with respect to this partnering.
Yeah. Telehealth has been a topic of conversation with healthcare providers, our clients, and patients for I don't know how many years, but it's been quite a while. And as we talked about, these pressures that come from different parts of the world, right? So if we can get reimbursement aligned and organizations want to sign up for it, and you can get the providers to engage in it because they find value in it and they're comfortable doing it, and you can get patients to do it, what's the best way to go about doing that? And as we looked sort of broadly, we recognized that American Well had an opportunity to bring something to the table that would allow us to focus our efforts more broadly. So why go recreate the wheel when you've got somebody who's doing it well, and we're creating this open and interoperable platform that allows them to plug in nicely. We wanted to get out there, we wanted to do it right, and we knew that they had a track record. So it was one of the reasons that we felt it was pretty critical.
Yeah, win for you, win for them, win for the customer, Win for the consumer. And now, a few words from your host. We'll be back to the show in less than a minute. I get email from listeners that want to know what I do. Hey, I'm a consultant that works in 3 areas: patient engagement, influencing healthcare consumers, and persuasive communication. Don't think for a second that just because you created or use some whiz-bang technology to lower chronic disease rates or capture patient-generated health data, that patients are going to raise their hands, open their eyes, line up, and get with your program. If you're treating patient engagement as a head-nodding, getting them to agree tactic, don't be surprised when they close you off. I was a provider for nearly 10,000 patients. I saw as many as 50 encounters a day, many of them self-pay and properly engaged on long-term care management. I also served in strategy and customer communications for a tech company serving millions of needy customers across the country. I know what it takes to reach patients, consumers, and the people that support them. I'm happy to chat. I'll let you know if and how I can help. Just email me, steveambrosucla@gmail.com. And now, we're ready for the show. I'd like to touch on current financial quarter with Cerner. The last quarter, we've seen system sales decrease 7.3% year over year, 21% decline in technology resale, and a 12% drop in licensed software with Cerner. You've got cutthroat competition. We've talked about it before from Allscripts, McKesson, Epic. So pricing and margins have resulted in Cerner's projected sales growth now pegged at a little over 8.5%. And the industry average is about 18.5%. What's the strategy moving forward from where you're at right now? And also, I know that we talked about going in on a better value proposition in terms of a more commoditized market with EMR, but are you also working with disruptive innovation as well to perhaps maybe offset that and open up some new areas?
What I would say is that our future and the world is changing, the business models are changing, and that's what you're seeing reflected in the numbers you talked about. It's not a sign in any way, shape, or form of our viability and long-term success and projection and trajectory. And I think the key thing with us is EMR sales and replacement market sales are still going strong. But what I would say is that as we're thinking to the future and where does our growth, because if we stay stagnant, the world's going to change around us and we're going to miss it. We're really thinking much more towards the future and population health and the new platform we're putting in place called Healthy Intent. So there's a lot of companies out there who are doing what I would call best of breed approaches. They're looking only at the analytics. They're looking only at the comparative data or the registry data. Some are looking just at their care planning, trying to get information or the claims data, or you've got insurers who are coming out with their look at it. All of that data needs to come into one integrated platform, and that's Healthy Intent. That takes the data. There's some applications that sit on top of it, but also then we're building a full integration of core aspects of it back into the EMR. So if you are on Millennium or you're on an open platform EMR, you'll be able to access that information as well as part of your workflow. Or you have another option to go out and access it through your internet or whatever it might be. So that's a big core part of our go forward strategy around the changing market and moving towards that.
Once in a while, I throw out a wild hair idea, and you are going to be the recipient of this one.
I'm game.
Okay.
Bring it on.
All right. Everybody on the health system and hospital, the provider side, talks about lowering costs. In my mind, the number one factor that drives up cost is going to be human capital. My wild hair idea is I think that more hospitals and health systems are eventually going to get into artificial intelligence, maybe to start off and augment what they're doing to drive down some costs and certainly improve quality. But I don't think it's going to be too long until you start seeing technology companies pitching hospitals and health systems on replacing human workers, so long as there's safety and so long as the quality of care is better and the scalability is better. And it's not often politically correct to talk about replacing human workers with computers. But I'd like to get your thoughts on this, on, a health system and a hospital world where eventually they look to drive down costs even more heavily, but also being able to actually replace their biggest source of cost in human capital.
That's a great question. I don't think it's such a wild hair idea at all. And of course, I'm sure it's in the back of people's minds in some way, shape, or form. So why not sort of take it head on and talk it through? What I would say, first off, is there's always a human element about healthcare and an aspect of healthcare that I can't see going away. And no matter how smart our computers get, we're still going to be having somebody there who's going to be interacting with us in some way, shape, or form. I think there is going to be a significant aspect of how do we use, whether you call it artificial intelligence or predictive algorithms, or how all of this data can be used to change healthcare. And truly, the more complex, though, environmental factors and social determinants get, and the more we realize their impact of them, the more we've got medications that are available to us to treat with, the more we understand genomics and information that goes into what's our makeup in response to a treatment or a disease. And even the diseases themselves, and we start understanding that there's subtypes of things that we never even understood before. I think there's a lot of information that gets in there, and I think there's a way to start collating that information and driving it and driving care plans and care pathways and precision medicine in the right way. I still believe, though, that you need a human element. You can have, there's usually some level of interaction that a clinician can add based upon his experience that you may not get. And we still have to create opportunities for new learning, because how could we make these advancements in some of the things we're doing if we didn't have some human interaction to think through what is the next advancement we need in the treatment of diabetes or leukemia or whatever it might be.
So last question here. We have a new president-elect in Donald Trump. What do you see, Joanne, in terms of the next several years in our healthcare system, and perhaps also in what's going to happen to our current Affordable Care Act?
Oh, my. What we anticipate is, he talks about repeal and replace. He talks about a lot of different things. Hard to know, because the replace part will be the hard part, to figure out what it would be replaced with. And I don't think we've got a ton of yet strong indicators. What I do anticipate is that in addition to, the federal government and working through Centers of Medicaid and Medicare, that basically there'll be changes that they might undergo. But the reality is we still have private insurers and the commercial insurers who are like the value-based purchasing, like the concept of the continuum of care, like the concept of bundled payments. We also have a much more enlightened consumer population, I will say. I think even the Affordable Care Act has helped us get consumers more aware of costs and things, even if it has been for the short period of time that it's been in place. So I think we're still going to have consumers demanding and driving a fair amount of the way we're going. I don't anticipate, and we've had a fair amount of discussion on this here at Cerner, I don't think I anticipate, or any of my colleagues anticipate, a tremendous alteration in direction broadly. I think we expect a fair amount of the work to continue going on, the focus on value-based purchasing, the focus on, alternative payment models, all of the things that you're seeing play out. What you may see is a change in the slope or adoption of them over time, and it may accelerate or it may decelerate. Hard to say. But the reality is we were seeing changes or disparity in uptake of it anyway, depending upon if you were in an urban setting, rural setting, what states you were in, et cetera. So I think we're envisioning we're current course and speed, move forward, continue on this trajectory, because the value that you've got in looking at populations, looking at data across, being able to talk about the value you're achieving, the quality, the outcomes you're getting, are absolutely critical to healthcare in the future. And it's what our consumers and patients and all of us deserve and demand.
Joanne Burns, Chief Strategy Officer at Cerner, we thank you for spending the time with our audience, sharing your thoughts. It was an absolute privilege and pleasure.
Well, Steve, thank you. It was a pleasure for me. Sometimes I appreciate those wild hair idea questions. They get us all thinking a little bit differently. So thank you.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.